Thank you, everybody, and good afternoon. We appreciate you're very busy, and thank you for taking the time to spend with us on the next in our series of webinars on the coronavirus pandemic. Just a couple weeks ago, we had a really interesting discussion with the leader of the infectious disease unit at Mount Sinai Hospital on the coming coronavirus vaccine and the recently approved monoclonal antibodies. And I think that what that did is it teed up this presentation very nicely for our guest, Delphine O'Rourke, who's going to join me in talking about what this means for employers and their employees, and really what is the role for employers as we approach this era. Delphine is a senior partner with Goodwin here in New York. You may recognize her from previous presentations that she's made with us, particularly, I guess it was in the late spring and summer. I think she's had at least 2 appearances with us, and the feedback has always been great. She gives incredibly clear and practical advice for employers on all of the coming issues that they're being faced with. And so we're just delighted to have you, Delphine. Well, I have to tell you that we really are in the depths of despond, as it were, in terms of where we are today in the pandemic, particularly in the US. The cases are just completely out of control. We see over 2,000 deaths a day, million cases a week. And it really feels at times that there will be no end. But I can just assure everybody that I personally profoundly believe that there is going to be an end, and the end is going to hopefully be sooner rather than later. And I do believe that the first quarter of this coming year will have a dramatic change in how we're living in America. And just to give you a little personal insight, which today was a huge day, if you haven't read the news, I received a text this morning when I woke up from my swim at 5 o'clock in the morning from my daughter in the UK, who is a senior healthcare executive and an epidemiologist. And she said, for those of you who don't know, the Pfizer vaccine was officially approved today in the UK. And she said, Daddy, there's finally a light at the end of this tunnel. And that's not for, that's for a deep professional in the domain. And I can tell you that all of us who've been intimately involved with public health for much of our careers feel the same way. We really are looking at a brightening future, and we just have to hang in there until we get there. And what today is about is what employers can do and how they, because everybody is going to have to step up to deploy this solution, this vaccine solution. And what is it that employers can do? Just a factual reminder, just some facts to keep in mind. The 2 likely vaccines that will be approved probably next week and the week thereafter are mRNA vaccines. One is by Pfizer and the other is Moderna. What makes these 2 vaccines so really unbelievable in the field of infectious disease and vaccines is that they have been shown to have a 95% effectiveness, meaning that 95% of the people who get this vaccine have been shown not, compared to a control group, has been shown not to contract the virus, and if they do, to have a much less dangerous outcome. We don't usually see this kind of seroefficacy, the seroconversion, in vaccines of this type. We see these in childhood vaccines like measles and polio and German measles, rubella, where they're usually live and attenuated viruses. This is a wholly new domain of science, and it is just a spectacular achievement to be able to have these technologies available to us in the coming weeks. And just to give people a sense of what it really means in terms of the lethality of the epidemic, think about that really 80% of the people who have died of this epidemic, COVID, have really been in a few selected risk groups, probably 50 to 100 million people. And really, by just giving those highly vulnerable people this vaccine, we could really pull the rug out of lethality. And we can do that sooner rather than later, which obviates all of the issues about hospitals being overrun and overflowing with patients and ICUs with patients and the like. And so we're not just looking at some little thing, we're really looking at a potentially big thing. And this big thing's impact is going to really be driven by leadership and by execution. And so I think that's what we're here today to talk about, how employers can be leaders in helping their employees, but also their communities become immunized, take the vaccine, and help defeat this pandemic sooner rather than later. So we're going to have a little bit of a different format today. I'm going to show this slide. We're going to look at 4 specific topics, and I'll introduce each topic, and then I'm going to have Delphine kind of discuss them in terms of her own practical experience and what she is seeing with employers. And instead of waiting right until the end for questions, I'll be happy if you want to write in questions immediately. I can start to take questions after we complete each topic so that we can stay relevant. And by the way, when we finish all the 4 topics, if we want to come back to any of the other topic, that's no problem as well. So let's begin, Delphine. The first is vaccine prioritization and distribution considerations. So we heard already yesterday from the CDC, people in nursing homes and residential facilities, older people in those facilities, 1A, and then essential healthcare workers, and then likely as we move down, people over 65, priority list, and then vulnerable populations. So naturally, employers are going to say, what does this have to do with me? Is there anything that should be front of mind for me in the way I communicate to our employees with respect to how you think about vulnerability and prioritization? And is there a particular role for an employer to start to potentially segment or communicate in a way to their to try and identify those people who are vulnerable? So why don't we talk about that? What it really means to prioritize some employees versus other employees, and how that really is impacted in the workplace environment.
Okay, thank you, David. And as you point out, CDC's vote and recommendation yesterday is very timely for this webinar. As we look at, everyone on this call is a leader. Your companies are leaders in your space. You're used to being proactive, to being sort of on your toes, to make sure that you're ahead. So part of what we're going to be discussing today is, what is that balance? What is that balance between where is the appropriate role for an employer in this public health conversation, in this privacy conversation, and ensuring that our employees are safe, and where are we stepping into space that really isn't the employer's domain? So what David started out with prioritization and the CDC. So that, as we know, is not going to be an individual employer decision. That's going to be a federal recommendation, and the states will all need to implement their plan. And while they don't have to follow the CDC, it's anticipated that most, at least in large part, will. And then we'll probably customize to a certain extent the prioritization based on the number of vaccines that they actually receive. So if you're an employer, and this is sort of my carve out, if you're an employer in the nursing home space or the healthcare space, the conversation is different for you, obviously. There you've already been earmarked. And in the healthcare space, we anticipate that there are going to be fewer vaccines than there are healthcare workers, and therefore there's going to be a prioritization within the healthcare workforce of those individuals who are most likely to be exposed. But those groups are different than most employers in the United States who are not in the healthcare space. In that, once we get to the category of, let's say, 65 and above, it is not the employer's responsibility, nor should the employer be identifying who's 65 in your community. Or if your state decides that some of the individuals who should be prioritized are those with comorbidities, it is not your job to identify who might have diabetes or not. Now, remember several months back, I mean, this is the analogy when we were talking about developing a COVID strategy. And on one hand, you want to, reach out to your employee who is going through chemo, but we advised at the time and continue to do so that that's not appropriate. While, it might seem kind, it will be interpreted legally as crossing the line. We're not in a big brother role. Now, we're going to talk about how you can support those employees. I think the clear communication there should be, it is not your role as an employer to proactively identify who may or may not be able to receive a vaccine. Now, that said, what you can do as an employer is provide information, up-to-date information, help your employees get information that is truthful, that is accurate, that is clear, that is relevant. And looking at your employee population, you might have de-identified, hopefully it's de-identified data, and know that you have a large percentage of your employees, for example, who are over 65. So making sure you're focused and your communication generally is geared towards your employees, but you cannot single out individuals and reach out to them and say, you really need to take the vaccine because, again, I know you have HIV and therefore you are more vulnerable. And
can I ask you a question on that, Delphine?
Sure, of course.
So we're a national provider group. We represent probably most of the employers on this call, and we see thousands and thousands of their patients as doctors and nurses and the like, and we have their medical records. We kind of think that it's incumbent upon us, if we know who's a diabetic, or we know who's hypertensive, or we know who has chronic lung disease, to let those people know that they may be in a vulnerable category, and to make sure that they get connected to the right resources for vaccination. Now, should we do that on our own as EHE? Should we do that in collaboration with our employers in a joint kind of a way? I mean, we want to do a public good here, which is get people involved. And I mean, everybody would agree that's a good thing to do, but we don't want to get people into trouble by, employers, by creating risk issues, by potentially dragging them into that situation. Obviously, they never would know the names of the patients, all de-identified, but we know, and we have their emails and we have their contact information. How does that fit into what you just recommended?
And that's a great question. And what you started out, your first sentence was, we are providers. We are working as providers.
Right.
Okay. So yes, you're integrated and you have really close relationships, but you're in your capacity as a provider, which is different than a capacity as an employer. So analogy could be, you have employees who go to a local hospital, their doctors aren't proactively calling their bosses and saying, Joe Smith has hypertension and therefore we think he should get the vaccine. So it's critical, and we've talked about this all along, we've even talked about COVID test results, to separate that. You as a provider providing care to an individual comes in and you know that they're over 65, have comorbidities, have asthma, et cetera, you're going to advise them and provide them with clinical guidance. That separation is critical. The same way when we've talked about COVID testing, we talked about cleared for work, rather than saying, this person has COVID or doesn't have COVID. But from the provider perspective, because there might be other reasons why they're not cleared for work, mental stress, et cetera. So keeping your provider hat on is appropriate, but not taking it off. And same with the employers. What's a little bit different is that most employers, you're a restaurant chain, you don't even have the capacity to provide medical advice, right? So it's not even within things that you're thinking of offering your employees. So again, you're a provider, very different.
Okay. So I have one question that just popped up. It's not directly related, but the question is, how long does immunity last? And the answer is nobody knows. We only know as long as the trials have been going on, and it's been just about less than a year now. But right now, it seems that the immunity is good. And obviously, as time goes on, we'll see what happens. All of those people who are in those trials are having their antibody levels checked and the like, and there will be some presumptions. We'll learn more as time goes on about what the exact protective value of these immunizations are. Okay, so I'm going to move to the next one, the communication guidelines, Delphine.
Mhm.
So here it's, you touched on this a little bit, but what strikes me, this is kind of a moonshot approach. We have, once in 100-year pandemic. We all live in cities, we all live in towns and communities. Large employers are influential. And let's face it, employees have parents who may be in nursing homes, or they may have siblings or friends or people in their household who have vulnerabilities. I mean, is there any obligation for employers to kind of get on this bandwagon and participate nationally with respect to communication, not just specifically for their employees, but potentially for people who are contiguous to them in some way, shape, or form? Or should they just stay silent?
So, and I love, you have the public health perspective. I mean, we should be helping our entire communities as employers, right? Where is our ethical or moral responsibility versus our legal responsibility? So communication, is important for a variety of reasons. And I'm looking at this also through the risk mitigation lens. You're, as a company, part of what you're responsible for doing, whether you have shareholders or privately owned, is managing your risk. And this is again, as you point out, very unique situation where you have a disruptive force that is, largely beyond your control, that is unprecedented, that has high financial impact, with laws that are not adequate to address the situation. So you're managing that risk, and communication is a great tool to manage that risk. So what approach do you take? I think the more communication, the better. So whether it's factual communication about the disease itself, about resources that are available, about the vaccination, just think about what you're currently doing. I like to go back to what you're currently doing. Mental health, more and more, for example, employers provide information about, suicide in the US or heart disease in the US. As general information that they provide their employees. In your communication guidelines, any information that you can share that's general, again, not, these 7 people we know are at risk. But yes, provide communication that'll also increase trust. You are an employer, and hopefully your employees trust you and the information that you provide. And we know there's a lot of mistrust around the vaccine. It was recently, Gallup polls that only 50% of Americans would consider even being vaccinated for a variety of reasons. So as an employer, it's also in you have a general obligation to keep your employees healthy. And the more information you can provide to them that helps keep them healthy, and to your point of parents or other people that they're around, if the people that they're around in their communities or in their homes aren't healthy from a COVID perspective, they're at risk as well. So information about transmission, information about, being at risk if you're elderly, provide it. Again, the caveat is you're not targeting certain groups. So for example, your call center people happen to be, overweight. Okay, you don't send a different distribution pamphlet to the call center people saying if you're overweight, you're at risk, and therefore you should probably be vaccinated. You don't want to make it specific to any group. David, does that make sense?
Yep. So let me then ask you on a little different side of this problem. Let's say, God forbid, one of these vaccines ultimately were shown to have a problem in 6 months or 8 months. And some people had some bad side effects. We saw some of the trials were potentially stopped for fairly sophisticated and rare neurologic diseases, which ultimately proved not to be related to the vaccine. But let's say there is a vaccine issue in one of the vaccines, and the employer during this phase has been actively communicating and encouraging people to get vaccinated, and there became a problem. Have they taken on liability?
Well, I would suggest that the employer, you're not encouraging them one way or the other. You know, you're saying you should be, and you might say, well, what if I require vaccination? You know, analogy, flu vaccine. Now, not every employer requires flu vaccine, but the EOC has indicated, so this is the federal body that controls this, that yeah, certain employers can require their employees to get flu vaccine or Hep C vaccine. The employer is not taking on it, you know, generally. And again, this is general thoughts, not specific legal advice, because it depends on the facts and circumstances. If your employee gets the flu shot at their local pharmacy, even if you might have a get the flu campaign, you're not assuming responsibility for that. You're not administering it, you know. And again, that's why we're employers. We're not providers, we're employers.
So providing information, but not saying, go do it.
We're
providing
providing
information, saying there's a 95% effective vaccine out there. Here's how you get it, but you're not telling that. You should be careful not to tell people what to do about it. Basically, you're providing information. That's the guideline.
Now you can, and we'll, you know, get into this. I mean, there is no law on this currently, and we were hoping that the EEOC again would have guidance out by now, because the EEOC has recognized that COVID is different than the flu, right? That the threat level is higher. There is no law on it, so that says, can you make a COVID vaccine mandatory? So look at what you've done around flu. You know, how have you rolled out that plan? Okay. We know there you're on legally sound ground. And again, you know, even if you're in an industry, again, healthcare providers, if they don't get the flu vaccine, then they need to wear a mask, et cetera. You know, look at the accommodation. You know, when we talk about return to work, are we talking about really return to work, or are we talking about return to physical or sort of interpersonal interaction? You could be returning to work and socially distanced and not near other colleagues. So like everything else you do for your company, there's no one size fits all. What is necessary for your employees?
Okay, so I have 3 questions here. These are going to be doozies for you, Delphine. Really interesting questions. What can a human resource professional do if the employees who get vaccinated are reluctant to work with those who don't want to get vaccinated?
So if those who are vaccinated are reluctant to work with those who are not vaccinated, that's, you know, that's a real possibility. So those who are not vaccinated, so let's step back. Vaccines help you not be the individual, it's self-protective. So the person who's taken the vaccine might think, well, you know, maybe this is 95% effective, but there's still a 5% risk. So there, you know, have a conversation with those who are not vaccinated. And those, this is, you know, and HR executives are used to this. This is when you engage in dialogue and say, okay, you don't want to be vaccinated. If you make vaccination mandatory, well, then these are the steps that we're going to take, either reasonable accommodation for the person who has been vaccinated, or the person who refuses, okay, well, you need to be social distanced. You'll still have to wear your mask. You might not be able to do the job, you know, and then let's look at that. You won't be able to travel. So there are definitely proactive steps that you can take, because you don't want either the person who's been vaccinated or the person who hasn't been to feel unsafe. I mean, your obligation is to make people feel safe. You know, so to engage in that conversation, and that's going to be a real issue.
Yeah, and I would say to the person who asked this question also, and I'm saying this from a medical point of view, if I get vaccinated, I'm not worried so much about the other people who aren't vaccinated, because I'm feeling that I have a very, very high degree of protection. And sure, I would continue to wear masks and socially distance as long as the virus was prevalent in the community, because that would be the safe thing to do. But that being said, my own personal risk, in my view, would drop dramatically. And that's a good segue to another question, which is a medical question, which is, what are the minimum vaccination rates for vaccines to be broadly effective at a national level? Mm-hmm. So I want people, this is a very important question, because people get confused about the effectiveness of vaccine versus the impact on what we call herd immunity. Those are two completely separate things. Herd immunity is the level of immunity in a population that makes it difficult for the virus to spontaneously transmit from one person to another. It's really just about math. Are there enough people who are close, living in the same household? And frankly, the herd immunity levels are much lower in extremely rural environments where you don't have a lot of contact. But the feeling is that to suspend or stop spontaneous transmission of the virus, you have to have about 70% of people immune. That could be either they've had the disease, that's called natural immunity, or they could have had an immunization. But by the way, even though you've achieved a level of 70%, and if a person is not immunized and they go to a sports event indoors, there's still going to be hundreds, maybe thousands of people who are still susceptible, and just one person who walks in could potentially give it to them. So herd immunity is a population concept, not an individual person concept. That said, the seroconversion of these vaccines, the protection, if you actually get the vaccine, is highly effective. And when you look at the studies, they've been shown to be 95% effective. And the very few who did get the disease had no serious sequelae, did not land up in the hospital, or there was no mortality. So you're really dealing with something for your own personal protection to be very, very effective. So we need to distinguish those two concepts. And then for you, Delphine, there's another question on this. What about the employer liability if the employer facilitates COVID-19 vaccinations by on-site clinics or otherwise? And I guess you're going to come back to the flu example, shot example.
Look at flu. You can contact your lawyer and have them disclaim it. You're facilitating. That wouldn't be a significant area of concern. You'd want to have the documentation you usually have. Look at what you usually do for the flu. What do you usually do? Maybe you have, blood pressure testing. More and more companies are having some, screening tests on site. Follow the same guidelines that you have there would be what I would suggest. Yeah.
Okay. So then another question is, what about specific communications to groups based on job responsibilities, not personal health status and age? Thinking those working in person may be encouraged to get the vaccine quicker versus those from home. It may not be as high of a priority. I think you touched on that. If you're an operator of nursing homes, obviously you're at the top of the list. But I think it's worth elaborating about how you might think about this as it relates to work status and job status, type of job.
And I think we want to differentiate between, when we say prioritization, it's the government that's prioritizing. Employers aren't prioritizing. It's the government that has said, and then the governments, when it rolls down to the state level, that are saying, okay, the nursing home residents and the nursing home workers will get the first doses. And then healthcare workers. And, even some states, we've seen already a lot of conversation around, what's a healthcare worker? Where does fire departments fit in? Where do police fit in? Is a back office person in a hospital a health worker versus someone who's working in the ICU? As employers, we don't need to prioritize. That's what it's going to be. It's doses. You could say tomorrow, well, I want all my employees who are over 30. A, there aren't going to be enough vaccines. And B, it's not, I think part of this is theoretical, and David can speak more to the timing. The vaccines aren't going to be available to the general population, in the next month, in the next 2 months. So this sort of idea that we can prioritize as employers. So I think what we're thinking is, okay, of our employees, who do we want to lean on to try to encourage them to be vaccinated? Because we don't pick the prioritization. If the state comes out and says, after healthcare providers, we're going to put, let's say people who work in restaurants. That's been, or who work, or frontline workers in areas where they can't, like janitors, for example. There's a lot of conversation around those people who have no choice. They can't work from home. We're going to have to follow that. So within our own employee population, The question is, can you lean on certain folks and encourage them to be vaccinated based on their job description? And there are certain people who, oh, David, no?
No, I was just going to say, so basically the short answer is stay safe by following the public health guidelines. Don't come out with your own guidelines and try and figure out what you need to do for certain employees. Basically stick with the official guidelines from the CDC. And frankly, here in New York, for example, the immunization guidelines are a little bit different. Every, as we know, every state is going to have a little bit of a different, and our employers should basically keep their eye on what those guidelines are. I think it's a safe answer, right?
Yeah, and I'd add to that, David, to make that link, where's the employer's role is, translating what, let's say, David says, when, David understands this beyond more than the average person. How do you translate what public health is saying, what epidemiologists are saying for that population so they understand it? And that's where you can have a role. If Oklahoma regs are different than New York and your manufacturers are in Oklahoma, making sure that they have the information and in a way that if they're the night shift, don't put it on the screensaver during the day. That's where you can have an opportunity to channel the information.
Oh, great points. Okay, let's move on to the next issue, which is the importance of employer leadership. So I'm going to be perfectly candid. I went to one of our clinics a couple of weeks ago, and I was talking to one of our nurses about the vaccine. By the way, Dr. Kamen said this exactly 2 weeks ago for those of you who are on the website, about he's got several hundred people out on nurses who are positive with COVID, and he talks to his own providers, and somebody asked him, well, how many are going to take the vaccine? He says, well, right now, only about half my healthcare staff want to take this vaccine. And the only reason I actually believed it was because literally the day before I'd been talking to one of our nurses in our clinic, and she said, well, I'm not really sure. This is a highly informed person. And so we live in an era of the politicization of science, plus many, many years of an anti-vax movement. And I said to the nurse, I said, when this thing gets approved, I'm going to roll up my sleeve and I'm going to come to the clinic and we're going to tape it, and everybody's going to watch me getting a vaccine. And the nurse said, well, Dr. Levy, I'm sure if you do it, then I'm going to do it. So the question now comes up to employers. Do they have a role and should they have a role in encouraging people on fact-based behavior, on evidence-based science? Is there a role to kind of potentially push against, the anti-vax movement? Is there a role for the employer? Should they assume an employee-specific or employer-specific and a community leadership role in helping to move the needle on this distrust of vaccination?
So let's unpack that. There's a lot, David. So, yes, there's no doubt leadership at the top, and whether it's the mask conversation in the country, and certainly we're going to have similar conversations around this leadership. People look to leaders. So as far as your community, a leader can have a private role and be advocating for vaccination in that person's private role. A company can take a side. I mean, companies have taken sides on wearing masks, have been pretty vocal about it. Black Lives Matter, taking a stance. Same rules though, when we're talking about our employees, still apply. Yes, you're a leader and you just need to do it within the confines. So you're not targeting any groups. So your idea of, going out there and being vaccinated in front of others, but somebody's refusal to be vaccinated and follow your lead isn't going to have a negative effect on their overall performance evaluation. So is there a role for leaders? Definitely.
Would you encourage the CEO of any of our employers on here to roll up their sleeves and have a video posted on their website of the CEO or the CHRO taking a shot, getting a jab?
You're the physician, No,
I'm asking you, is there a risk from a legal? Listen, I know what I would do as a healthcare person for my healthcare providers, but I want to know, should an employer roll up their sleeve and by way of good example, show the rest of their employee group that this is a good thing to do? Or is that too risky?
I'm not suggesting it's too risky. I do think it's a personal, and that's why I'm sort of going around your question. It's a personal question. I mean, some CEOs will say, I don't feel comfortable doing that for a variety of reasons. You know, that's not something I do. But if you do it every year for the flu vaccine and you get out there and you show your employees, I think that's really personal to say, yes, you should go out there and do it, or no, you shouldn't. You know, but again, so coming back to that, either way, you know, what do we always say? Policies written down. If that's what you plan on doing, if that's going to be your approach, be consistent. Write down, this is going to be our company's philosophy. What's our practice? What's our policy around vaccination? Make sure it's reviewed, and including what your leadership team is going to be, you know, communicating down, because you do want, like any other, you know, and any other management issue, to be consistent in communication. And around this one, there is so much misinformation. And I'm not saying from a scientific perspective. I mean, I've heard crazy stories. The other day, somebody told me they wouldn't get it because they think it's the government tracking their location. So it's not a vaccine, it's just tracking their location. I mean, there's a lot of misinformation. And there, I do think there's a role as a community, and employers come up with that. Or what are the facts? You know?
Yeah, so but I just had another question come in. I'm sorry to keep on prodding you on this, but I'm just going to read you the question direct. If a CEO does post their vaccination video, have they exposed their company to any legal liability?
I'm reading right here by anonymous.
I'm sorry?
I'm just reading the question too. Have they posted to any legal liability?
If a CEO posts their video, are they exposing the company to legal liability?
So anytime you do anything, you expose your company to legal liability.
Something like a true lawyer.
Right? You know, so and that's the risk analysis. And I'm not trying to dodge it, but there isn't a blanket answer. Talk to your senior team and say, what's going to be our strategy around this? You don't want the CEO to be posting vaccination videos and then have the rest of the company say, no, it's not mandatory. And we don't think that this, you know, we think it's just a GPS liquid that's being inserted in our veins, you know? So what's the overall strategy? What's the overall company position on this initiative?
Okay.
And then, you know, the CEO should be consistent.
In a much more serious note, I do want to add something that I just learned this weekend on this, and may make some people feel uncomfortable, but I just feel I have to just share it. Every Sunday, I have a group of healthcare executives. We get together and talk about things. We've been doing that since the beginning of the pandemic. And one of them is the CEO of one of the largest health plans in New York. And they have been surveying people in New York, and in particular, the reluctance of people of color to get vaccines, many of whom have voiced in surveys that they believe that the vaccine is designed to kill them, to kill people of color. It was a shocking statement to me. I literally, you know, and again, I'm from Canada, so most people don't know, but you know, again, that there's an oral history about this. And she said their organization is seriously confronting a very specific strategy to counter some of these, you know, incredibly difficult narratives that have been built up through time. So you know, I'm not sure that requires an answer, Delphine, but this is not just gentle pushbacks. You know, there are some certain aspects, there are certain parts of our communities that really have very, very strong points of view on this, and is a real problem. And as I said, this is a healthcare company, and these are healthcare workers. So it's a big issue.
And I actually would like to respond to that, or just add in, that's, you know, that's an opportunity where an employer might say, where can I help? Because what you're talking about are, you know, historic health inequities, distrust of the system for, you know, valid reasons. We're also finding that in certain, you know, ethnic cultural groups that are concerned about immigration consequences. Right. So, you know, that can be a resource. If you have employees who are concerned that if they bring their grandmother in, she's going to be deported, you know, providing counseling around those types of issues, those are barriers for individuals who would like to be vaccinated. but they're there voluntarily. So you can, reach out and say, if you have any questions about the impact of trying to obtain vaccination and immigration status, we'll be having open hours, not trying to identify who you think might be concerned about that. Those are real concerns about, there are real concerns in accessing healthcare generally. So, that's an area as community members and employers as part of community members, what are the sort of socioeconomic structural barriers that might prevent people from accessing healthcare generally and vaccines specifically?
Okay. So now we have a couple more questions, but because a lot of them deal with the fourth issue, and I'll get back to the questions, but let's move on to the last one, which is the regulatory considerations and scope. And obviously the one top of mind for everybody is, once the scientists, the CDC and public health officials have basically laid out the risk groups, as it were, and then it gets distributed to the general population, can you mandate immunization? Can you exclude people from the work site otherwise? Where do you think this is going? And I know there's no legislation, there's no guidance, I don't think right now, but where is this thing going?
So let's assume we're fast forwarding, right? We're not pausing on the fact that there might not be enough doses. So let's assume everybody who wants to be vaccinated or everybody in the whole world can be vaccinated. There are no cost obstacles, et cetera. As an employer, can you say, if you want to return to the workplace, you need to be vaccinated? So as David pointed out, there is no law currently. We think that there will be, but there's no law that says whether or not you can require the COVID vaccine. So getting back to the flu, because that's our closest analogy, is how has mandatory flu vaccination been interpreted? And even where an employer may legally mandate flu vaccination, and there are exceptions though. So I would say, think of that framework. It can be mandatory, but then you need to think about ADA exceptions. So if an employee has a disability that's covered under the ADA that prevents them from taking the vaccine, then an exemption would be considered a reasonable accommodation, unless same standards that you're used to, pull in your HR tools, unless there's an undue burden. Now, for most of you on this call, significant difficulty or expense for the employee. So expense is a really tough bar to overcome, to say that it's so expensive for a large company to accommodate an employee. Is there other undue hardship? So if you say, okay, we're going to make it mandatory, what's the ADA? There's also a religious accommodation provision under Title VII of the Civil Rights Act. So again, same analysis. If people are coming forward and saying, well, this taking the vaccine is conflicts with my religious beliefs, engage in the conversation and let's look at the accommodation that is necessary. All of these situations, interactive dialogue, other category, unions. We don't know where it's going to land on unions, and we know that the unions have been very active. Fire Department of New York, their union recently said, no, we're not going to make it mandatory. So, it's possible that the EEOC would approach COVID differently. They have, as I mentioned before, recognized that it's a much more significant threat than the flu. For now, think ADA, Title VII, make sure you have a reasonable accommodation. And if you do have unionized employees, that might be a completely different conversation.
Let me just ask you a little bit of a nerdy legal question, because Dr. Kamens mentioned it 2 weeks ago. Is there a difference between the ability to mandate, or what the EEOC says, probably haven't been here to know the answer, but the difference between an EUA and an emergency use authorization, which is not a formal FDA approval, versus a formal FDA approval in terms of potential regulatory activity? It feels like the comment that until you have formal FDA approval, we're likely not going to see a lot of regulation put over this. Is that a fair comment?
Was it on sequencing? I mean, it'll be interesting to see when the EEOC issues its determination. Generally, they're not super aggressive in the timing and see, okay, what's the situation? I mean, it was a couple of months between the start of the pandemic and, EEOC guidelines. So I'm not going to answer your specific question because I don't think we know the answer, but just more generally, usually the EEOC waits and sees what's out there before it comes down with new regulations. They're not trying to be the most proactive regulatory agency. And what you don't want to do when you're thinking about, again, there's similar themes. Hopefully we'll come away as use the tools that you already have, and you can't target employees, even if you think it's helpful. So I recently received this question. Well, we know that COVID has disproportionately impacted people of color. That was their conclusion. And therefore, should we proactively approach all of our employees of color? And we're employers, we're not scientists. Don't target, rewind to the beginning of COVID when employers were asking whether they could test their employees of Asian descent first. No, so these are, again, these principles, and as long as don't forget them because of the stress around the COVID vaccine, you should be able to mitigate your risk.
Okay. So we have a bit of a summary question here for you, which is, what are the top practices HR can adopt as the vaccines get rolled out? And they've listed, they said, provide accurate information, number one. Number two, don't target any employees or groups. Three, what else?
Three, document. And you should start on this now if you haven't already. What's your strategy? It doesn't matter when you have a date. What's your strategy? What's your framework going to be? Are you going to be, remember testing? Some companies were really proactive and said, we're going to test our employees every day. What's going to be your overall philosophy and risk tolerance? Start on your strategy if you haven't done it. Have your policies in place. Think about, if somebody does get vaccinated, how do they prove it? Do you want them to bring in the state certificate? Are they going to have to upload it into an app? If they don't have it uploaded into an app, can they still get into your office? These are things that you can consider now and document. So as you're saying, accurate info, make sure you're not targeting groups specifically, document, and you can start on that now. And then make sure that your privacy controls, whether it's HIPAA protected information, privacy information, that those are airtight now. The fact that someone has been vaccinated or not vaccinated should not go in their personnel file when they're up for review 6 months from now. Make sure your teams fully understand ADA accommodation, have to have those conversations. These are all things you can do proactively now, while we wait for vaccines to come down the pike for the general population.
Delphine, now I speak from a position of being a CEO, and as life is really complicated these days, and every morning I wake up, I realize I have fewer answers and more questions, which I think is a good thing. For thinking people, we ought to think that way. So what you're really saying is, don't sweat to have necessarily all the answers today, but at least do the diligence to show that you've thought through all of the questions, and that you've basically taken the time to look at the resources, to think through the strategy, and that you've really paid attention, because paying attention is the most important thing to do, given the fact that there is no black or white answer necessarily to some of these questions. Is that a fair statement?
It is a fair statement. I'd also say that we have a higher burden now than we did in January. COVID hit most of us. Maybe David, people like us who are in that space, we're seeing it coming, but like a ton of bricks. No one saw it coming. I mean, most people didn't see it coming. Right now, the difference is we know this is going to come. If it's going to be in June or July or 2025, we know it's going to come. So, the excuses of we didn't know, we didn't know how. Remember back in January or February, people thought that children couldn't get it. or that there were no asymptomatic, carriers.
Or
So,
that masks didn't work.
or that masks didn't work, or, now when you look back, you're like, really? Is that crazy? So yes. So you can start working on those pieces now. These are tools that you already have in your toolbox, and, brush up on them. Make sure that your employees are clear on what can and can't be done. Make sure that you have FAQs, for example, because employees are going to ask you. Do that legwork now so that you're not scrambling in a week or 2 weeks like we had when, I was advising clients when we had to shut down. We did not have much time to think through the big issues. Now you have more time to think through the big issues, and my, sort of parting advice would be maximize that time, even if you don't have all the answers.
Okay. I have one last comment. It's not a question, and I appreciate it. Somebody said, thanked me for bringing up the issue of vaccines with respect to people of color. And this particular questioner referred to a project, Tuskegee Project, which had been cited many, many times, about really cast a pall over some efforts that have been done historically with the Public Health Service and the CDC. And so that's where a lot of these this oral history comes from. So I was a little anxious bringing it up, but I appreciate that questioner for saying that she was happy that I did that. So thank you for that. So that brings us to an end. I think I would just like to make a wrap-up comment on this, Delphine. And none of us have ever been through this. Personally, I have studied epidemics, and I participated. I led a large team to do the pan flu planning for the state of California about 10 years ago. Nobody ever imagined we would see this, and there's a lot of unanswered questions. And I would say to the audience today, sure, there's a lot of risk around everything that Delphine talked about, and sure, there's going to be questions about what the right thing to do and what the wrong thing to do is, and is there too much risk or too little risk? I would just suggest to everybody, and I say this to myself every day, if you're going to make a mistake, err on the side of life, because that will stick with you forever. Err on the side of life. We are in the public health crisis of a century. We likely will never see anything like this before. If you're going to make a mistake, do it for the benefit of life. And that would be my closing comment. And I know I may be saying the wrong thing, Delphine, but I just...
David, I would say, what I think one of our biggest risks is that we care for people. And we say, David, I think, I know you have health issues, and therefore I want to help you and get you first in line. And I can do that as a friend. I can't do that as your boss. And I think that's the risk, is we want to help. And sometimes wanting to help is not what we can do.
Okay. So with that, we're going to close out. Delphine, I can't tell you how much I've appreciated, and we've all appreciated you doing this. It's going to, once we get through this epidemic in hopefully in the next few months, we're going to have to find another way to have you to continue to participate with the EHE Health, because you've really added a lot of value for us, for me personally, for our team, and for our clients. So thank you very, very much. We really appreciate it.
Thank you.
And thank you, everybody, for taking the time to attend. I will answer any other questions, as you know. Whoops, I'm supposed to read something to everybody in terms of contact. You can always connect to from our health portal at covid19.ehe.health, or we have an 800 line, 844-258-1820. So thank you, everybody. We really appreciate your attendance.